Good afternoon, everybody, and welcome to our webinar on digital communication, introducing video telehealth visits and My Health Record with your patients today. Before we begin, we will do an acknowledgement of country. Northwestern Melbourne Primary Health Network would like to acknowledge the traditional custodians of the land on which our workplaces, which our work takes place. The Wurundjeri Wurrung people, the Boon Wurrung people, and the Wathaurong people. We pay respects to elders past, present, and emerging, as well as pay respects to any Aboriginal and Torres Strait Islander people in the session with us today. Before we begin our presentations, here is just some housekeeping via the Zoom webinar. Just letting you know that all the attendees are muted. Please ask questions via the Q&A box only, and the Q&A will be at the end of the presentation. So as we have 3 presentations today, it'll be great if you could just add those questions while the presentations are happening. This session is being recorded. Questions will be asked anonymously to protect your privacy. Please ensure you have joined the session using same name as your event registration or phone number if you have dialed in. Northwestern Melbourne PHN uses a Zoom participant list to mark attendance and certificates, and CPD will not be issued if we cannot confirm your attendance. If you are not sure if your name matches, please send a chat message to us to identify yourself through the education email. So we have a series of webinars that we are all facilitating. That's together today with the Murray PHN. We'll be hosting today's webinar. And also we, in collaboration with Eastern Melbourne PHN, Southeastern Melbourne PHN, Western Vic, Gippsland and Tasmania PHN, we are working collaboratively to organise these webinars for you all. So these are the ones that are coming up from West Vic and Semphin in April and May. So today's agenda, we have 3 speakers. The first agenda item is using Health Direct video call for residents, video telehealth appointments, telehealth in residential health care, and the My Health Record. And our speakers for today is Dr. Thankar from ARIA Health, who's a geriatrician. We have Jude Cobb, and we also have her colleague, Jodie Earle. And unfortunately, Vandana is away sick today, so we have a replacement, and Marwa Osman will be replacing her today in today's presentation for the My Health Record. At the end of the session, you will also be given a code which is similar to this for you to provide us feedback. So I hand over to our first speaker, Jude Cobb and Jodie Earle. Thank you.
Thanks, Sonia. Okay, hi everyone, I'm Jodie, the Customer Support Officer for Health Direct Video Call, and you'll also be hearing from Jude, our Customer Engagement Officer. We'll quickly run through using Health Direct Video Call for telehealth appointments in residential aged care facilities. We will also provide a copy of this presentation to everyone that's attending today, and please, as mentioned, if you have any questions, pop them in the Q&A and we'll answer those for you at the end. Thanks. So as mentioned, we'll do a really quick introduction of our platform, how to plan for using video telehealth and then we'll do a quick demonstration so you can see what our platform looks like and how it works. Before we get started, we'll just let everybody know that Health Direct Video Call can be used on any device, anywhere. So from a phone, laptop, iPad, desktop computer, and it works with a virtual waiting area. So there's a dashboard that you will see when we do the demo. So you need no special equipment or software downloads. It is a web-based platform, and callers that you're inviting in do not need an account. So they just click on a link, no apps or anything required. We have fully encrypted connections and store no personal health information on our platform. And the service is government funded, so it's free to use for eligible health services, which includes residential aged care facilities. Okay, so before you get started implementing video call, there's a few things that we'd suggest that you consider. So who would be your telehealth coordinator in your facility? Would it be you, or will you delegate it to a nurse or other staff? And it could be more than one person. So the kind of things that the telehealth coordinator would be responsible for is organising the appointments for the residents. And that would be using the same processes that you currently use to make health appointments. Once an appointment's made with the health service provider, the coordinator can invite other people into the appointment, such as family members, interpreters, as required. The coordinator would also assist the RACF staff with training and familiarisation so that they can support them in support residents attending their appointments via video. And there is also an option to access and run telehealth reports on our platform if that's something that would be of interest to you. It's worth having a think about which equipment you'll be using. So maybe a tablet on wheels that can be moved to the residents' rooms, or a telehealth room set up somewhere in the facility where the residents can be brought to do their sessions. It's worth thinking about the workflows that you might use that would fit in with what you're currently doing. So that could be for booking and managing appointments, sending the link, assisting residents who's going to be doing that. Finally, planning and delivery of video telehealth training for the staff in your facility. On our resource centre, which we'll share with you, we do have a planning template for RACFs. This does sound like a lot of things, but if you just tick them off in the template, it'll make sure that you're ready to do really good, meaningful telehealth with the residents there. Okay, thanks.
Thanks, Jodie. Thank you. As mentioned, my name's Jude from Video Call. So as Jodie mentioned there, you know, there's all of our information actually is in our resource centre, but you will be shared the slides at the end as well. So when we go through the demo, you can just watch. You don't need to take any notes or anything like that. So once you have decided that you're going to use Health Direct Video Call and you've done the little planning document, it's all very intuitive. You just fill that out, and then you can register for a clinic through your PHN. You can also register for a clinic through us, but usually through your PHN. And then what happens is when the clinic is created, the first person who's going to join the clinic, which is the clinic administrator, which would be the telehealth person who's designated as sort of the telehealth coordinator in the facility, would create their account. It's really simple. You just basically get an email and you click on the create account button. You sign in, and then that person can add the team members. So you usually add team members using their email addresses, but please note this can be accounts for individual staff, or it could be generic accounts. Say if you have 3 iPads on wheels, you could make a generic account for each of those that can be used so people aren't using their own email address if they don't have a work email address. It can be done either way. And then you can start sending the clinic link to health service providers, so doctors and specialists, and any other required participants such as interpreters, family members, whoever you would like to get into that call that are in different locations. You can have the one call and have multi-party calls as well. So when you're invited to create your account, you basically just get an email that looks like this. It has a little bit of information. It has a video that you can watch, and you just click the create account. You just put in the name and create a password, and then you've got your account set up. Now, what you can do when you come then to our sign-in page, and this information will give you the links and everything for the sign-in page. So it's all browser-based. So I'll be going into the Chrome browser in a minute and just doing a bit of a demo. You basically come in, put the email address that's associated with the account that you're using and the password, and then you'll access the RACF clinic. So we'll get into a demonstration. So I'm just going to flick over to Chrome and make that full screen. Hopefully you can all see that okay. Someone can let me know if that's not big enough. I've just made it a little bit bigger. Hopefully you can see that okay.
It's all
so
good,
this is
Jude.
our, excellent, thank you. This is our sign-in page. This is vcc.healthdirect.org.au, and you can save it as a bookmark, which I've done here. I've just bookmarked it in the Chrome browser. You can also have it set up on, say, the page or the desktop, whatever you're using, or of your device, so that you can have it on the home screen and then just basically click on it. So that can all be set up for staff in RACF just to make it really easy to sign in. So I'm just going to use the email address that's associated with the account that I want to use. Click next, and then I'm going to enter my password. Now, I've had my browser remember the password, which is always an option as it comes up when you sign in the first time. You can choose to do that if you like. And I'm going to click on the login button. That'll take me through to any clinics I have access to. Because I have more than one, it's taken me to my clinics page. But most of you would be in one clinic. And in that case, as soon as you sign in, you'll go straight into the clinic waiting area. So this is the clinic waiting area. It is where you'll see any people that you've sent the clinic link. And this, in the case of RACFs, will be health service providers and any other participants that we mentioned earlier coming in here to be joined in a video call. So currently you can see there's no current waiting or active callers in your waiting area. So what I'm going to simulate is that I'm RACF staff and I've got a resident that has an appointment. So that's all been organised previously, and the link has already been sent to any required participants, including the doctor. We'll say we're seeing a doctor today. So that link's already been sent, but it's a little bit early and they're not in the waiting area yet. So we do suggest it's a really good idea to go and get the iPad on wheels, let's say, or whatever it is that you're using, and getting that early, taking it into the resident's room or wherever the appointment will be taking place, getting the resident ready, make sure everything's ready to go, so that when that doctor and any other required participants arrive in the waiting area, you can join them straight away. You don't need to leave them waiting, so that you're just prepared and ready to go, and then the consultation can begin. So before I do a quick demo with Jody, I'm going to just show you where that clinic link is. So as Jody said, whoever currently sends out any appointment information or makes appointments would send the clinic link through to, say, the GP practice or the specialist or whoever it is that the resident has an appointment with. It's this link here. Every clinic has its own unique link that you use. You can copy that link and you can put it into an email, for example, or if you have any other software that you use to send out communications to people, you can use that and just copy that link, let them know it's a video call, and they can use that link to come into the waiting area. So you can do that, or you can send it directly from the platform with this little SMS or email button. You just need their email address, you type that in, or if you know that the person's going to be attending by phone, you can send them an SMS. So it's just a simple tap on a link and you can send that through. Now, when you've put those details in, you can change the wording in here to suit whatever you would like. It can be edited and then click send. Once you click send, that will go through. Now, you can do that in advance of the appointment, however you would currently be doing it. And you can see here now that Dr. Jody has come in. So she had received the link previously. She's finished with her previous patient and now she's come in. And so we want to join Jody. And remember, I'm the RACF staff member. I've got the resident with me. What you can also do, just really quickly, you don't need to do this, but just so you know this is an option, the little 3 dots to the right gives you a couple of more things you can do, and I can just notify. So I could type in a message in here. I'll just put message, but you could type in, "Hi, Dr. Jody, the resident will be ready in 1 minute. You know, sorry for the delay." If there is any delay, hopefully there won't be, and you won't need to do that, but you've sent that message to them and they'll see it on the screen while they're waiting for you to join them. So that's just a little option that you may or may not need. The main thing you want to do as the staff member assisting with a telehealth appointment is come in here early. When the doctor arrives, you can click on join. So I'm going to click on the join button. I'm just going to turn off my video in Teams and, oh, sorry, in Edge. I'll just click on join. Confirms who I'm joining, and now I'm going to join Jody in a video call. So that's opening up in a separate browser. I'll just mute myself in there. So now you can see that we are now in a video call. So that's me on the left. I'm the person, I would have the RACF resident with me, and there's Jody, and the consultation would begin. So as the staff member, I can get that going, I can join, I could then step out of the way. The resident can be front and center so the doctor can see them clearly. It's a good idea to make sure they're really well lit. It's a nice private room and everyone, you know, they can be heard as well. And get them front and center so they can be seen clearly by the doctor. And then this consultation can continue. I'll just show you one thing you can do in a consultation. There's a few buttons down the bottom. I'm not going to go through that today, but just so you get a bit of a flavor, if I click on apps and tools, there's a range of things. You can do a screen share, just as I currently am in this webinar. You can share an image or a PDF. There's a range of things you can do, and your doctor, the doctor or other participant can do that too. So Jody, for example, could share with me a referral, and then that could be downloaded at our end and we could use that referral. So that's all possible doing a video call. I'll just share an image so you can see what it looks like. Just say we've got an X-ray result and an image, and I share that into the call so Jody can check it out, and we can discuss, and she can also download that at her end as well. So there's a range of things you can do in a video call. You can annotate over the top of these, and you can see all of that in our resource centre as well. So I'll just close that up. So once the consultation ends, you can click on the red hang up button, and the doctor would have said what's happening next, the next step. So perhaps, you know, made another appointment, or that they're going to contact the telehealth coordinator to make another appointment. Everyone says goodbye, click on the hang up button and end the call. That will end for everyone. Just before I do that, I'm just going to return to the call. I'll just let you know that you can add other people into the call. So we haven't got anyone waiting there at the moment, but if I go back to the waiting area, you can see my call. If there was anybody else waiting here, so say a family member had been invited, for example, next to their name, instead of a join button, there would be an add button, because video call knows you're already in a call. So you can give the link to say 3 or 4 people if they're required in the call, and you can come back to this view here, which is just a separate tab in my browser, and click the add buttons for the people you would like, come back to the call, and they will be in the call. We are going to send around at the end, we're going to share a little recording where we actually demonstrate that a little bit more. So what I'm going to do now is end the call. That will end for everyone. Sometimes there's a little survey which you can fill out if you would like, and then come back, and now I'm back in the waiting area, and I could then take the iPad. If I don't have another resident that I'm assisting, I could take the iPad through and put it on charge wherever it's kept for the next person to use. Say you've got 3 iPads, and you just make sure that they're all charged up and ready to go. So I'm just going to, it doesn't want to share. Oh, there we go. All right, so we do have our resource centre. We will send around these links, as I said. So everything we've covered today and more. We've also got an aged care portal in there, which will be very useful because all the information is in one spot. Thank you. How did we go for time? I think we made it. I think you're on mute, Sonia.
Sorry, I was too. Technology for you. Yes, I just said thank you, Jude and Jody, for a great demonstration of Health Direct. So again, thank you so much. And I will now hand over to, I will introduce Dr. Thanka, actually, who's a geriatrician from ARIA Health, who will be presenting on telehealth in residential aged care. Thank you, Dr. Thanka.
Thanks very much, Sonia, and thank you to the previous speakers as well. So I'll just present my disclosures to start off with. And I think what's important here is probably the context. So my work as a geriatrician with ARIA Health sees me visiting older residents in residential aged care, and I do what's called comprehensive geriatric assessment. So that's quite a long, at least 60-minute type consult with the patient. And we are really quite focused on making sure that that is done well. And often that has to be done in person for various clinical reasons. Rarely I've done that as that initial consult as a video telehealth consult, but often it is too complex an assessment to do. So often the follow-up for selected patients when it is clinically appropriate is when I say, hey, why don't we use video telehealth in this instance? So the clinical appropriateness and patient selection is really important. And video, we find can be harder to organize, and I'll talk a bit about that and how to make sure that workflow is smoother, but almost always more valuable than a phone consult from a clinical perspective. Not to say there's not a place for phone consult, but you just need to be thinking about what's going to be best for this particular situation. I also work in the public health system at Austin Health, and there we use the Health Direct platform across both organizations, actually. And that's all through the clinic setting, as well as previous work with the acute residential inReach service. So this is more of an emergency response, and my colleagues continue to use telehealth in that setting. So that's what I do and what I'm hoping to do today. I can see there's a mix of residential care staff and doctors on the line today. I would like to present a clinician or a doctor's perspective or a specialist perspective on, well, what makes a valuable telehealth video consult and how do you ensure that that is clinically useful and a good experience for everyone involved, and then more likely to be used again the next time. So this is an outline of the talk today. I'm going to run through, well, how do you make a decision about whether a video consult is a good option for you and your patient or not. We'll go through some technical factors, environmental factors, and some human-based factors, and that's probably the most important thing when trying to make that call. And then I'll walk you through my workflow as an example, what needs to be thought of before the consultation and what happens during the consultation. After the consult, it's probably fairly similar to what you do in person, but that's kind of what I'll walk through today. And I think Jude's already spoken to some of these things. It'll be useful to reiterate them from a different perspective. So to start off with, is a video consult a good option? What are the technical factors? This has sort of been talked about already, but you need to make sure there's a device at both ends that's going to do the job. So it could be a computer. Health Direct is now mobile and tablet enabled. It wasn't when we first looked at it 5 years ago, and they've come a long way. But whatever compliant solution you're using, it needs to be able, you need to have the hardware and the software, the computing power to be able to support that. It needs to have a camera. So my understanding, and Jude will correct me if this is not correct, is that the device has to have a camera. So if it hasn't got a camera, you can't start the call. It needs to have a microphone. You could consider headphones at your end. That can often make it easier to hear, but more importantly, the microphone quality might be better. And just at a higher level, you need to be thinking about data security. Is the device you're using going to ensure a reasonable amount of data security? Is the Wi-Fi network or the internet connection you have secure? And is the modality you're using, Health Direct or otherwise, is it compliant, and is it going to be okay with the privacy principles and requirements from a legislation perspective? If you're not sure, ask for some advice. So that's the technical side of things. Moving on to the environmental factors, to what would make a reasonable video consultation. I'll talk about, my setup here. This is what I use for telehealth consults when I'm consulting, when I'm working at home. I've got a window over here. I've set up a lamp on this side so that the lighting is equal and people can see my face. Otherwise, the camera gets confused by my complexion and it does not focus, which makes it difficult for a patient to be able to see what I'm doing. A lot of older patients will need to lip read if they're hard of hearing, and additional sort of problems with the picture quality can really detract from their ability to engage, and it detracts from rapport. It can have a clinical consequence if your environment is not set up properly. I'm wearing a neutral shirt. I've found that wearing complex patterns can actually, again, confuse the camera, degrade the video quality. I've made sure that the environment is quiet. My dog is downstairs. She's not barking next to me. I've made sure that there's adequate privacy so that there's not other people around. The window's not open, so that, sensitive material or sensitive conversations are not audible elsewhere. And no matter what your setting is, you need to have these things in mind. If it's in the workplace, you need to make sure that you've got dedicated space. Ideally, you're not taking calls, in the car while you're driving, that sort of common sense stuff. And most importantly, the human factors need to be thought about to ensure a good quality clinical and experience from a telehealth perspective. So, especially with my patient group, which is older people by and large in residential care, I need to be thinking, well, what things are going to make this video consultation not a good experience and not useful for them clinically? Firstly, have they got hearing impairment? Have they got hearing aids in? Does the person that they're with, maybe there's a support nurse or a support personal care assistant, have they asked about hearing aids? Do they know them? Have they brought them along, or are they still sitting in the bedside table and the patient hasn't told them because the patient's got cognitive impairment, has forgotten? Okay, so that's really important, needs to be flagged before. Same line of thinking, is their vision okay? Do they need glasses? Are they wearing them? Have they got visual impairment that is not correctable? It doesn't stop them from engaging with the consultation, but I just need to know that, because if they're legally blind, I suppose, it'll change the way I interact. It'll change my body language. I will depend more on speech. Does the person need assistance? Are they physically able to manage a computer? Have they got severe arthritis or pain in their hands? Do they need someone to physically help them step through the login process? Do they need that person there because they've got cognitive impairment? Do they need a support person because they're not digitally literate? They don't know how to use a computer. They don't want to use a computer. So these are all factors for the patient that are specific to them that need to be considered beforehand. And that's why a support person is often very useful. Certainly for the setup of the call, it depends on how long the consultation is. Sometimes it can be very helpful for me to have a nursing staff member there to help with some of the physical examination, moving the camera, and to be able to take a blood pressure, be able to take some vital signs. One thing that is really quite handy with the Health Direct platform and other platforms is that you have the ability for a family member who might be at work, might be elsewhere, to be able to join in remotely as a third party. There might be another specialist or another clinician who wants to join, perhaps a physiotherapist. Maybe there's an interpreter that's needed. Maybe that's a remote interpreter that joins in the call. And last, certainly not least, you need to be thinking about cultural awareness as well. You need to communicate that this is a video and not a phone consultation, because it may change the way that the patient approaches it. They may need to prepare or think about their dress, or maybe there are some cultural reasons that mean that they don't want to engage with a video call. They would actually rather prefer a phone call, and that option just needs to be raised. So those are the kind of broad factors to consider when you're going, is this going to be appropriate for this patient or not? And from a workflow perspective, this is how I would set up things before the consultation in cooperation with the patient, family members, or informal support people, as well as formal carers, so residential staff management, the care staff nurses, and PCAs, personal care assistants. So first of all, is telehealth the right thing to be doing for the reasons I've just mentioned? Communication beforehand is really important. People need to understand, not just the patient, but the people around need to understand it's a video call, that there is going to be a link sent across. They know where to look for the link. They've got the hardware set up. They've got the internet accessible. They're not in a dead spot in the nursing home where there's no Wi-Fi, which seems to be built into every nursing home. I don't know why. So just those sort of practical things have been thought about. One thing that I get our admin team to do is be very careful about scheduling. So we don't want to schedule over residents' lunch breaks so that we're causing them to miss a meal. We don't want to schedule over nursing handover time so that we're really disrupting the workflow from the care facility's perspective. Ideally, if we've not done telehealth or video consult at a particular facility, we'll try and organise a test run, either just before the consult starts or perhaps a day or two before. This is the ideal. Things work as planned. If they don't, think about a plan B. Is there a different video platform that's compliant you can use? Have you got a phone number? Have you given your phone number to the nursing staff member in case there's an internet connection? I think my internet just blipped for a second and kind of went off. That might happen. What's your plan B? Plan C. And finally, punctuality is actually quite important. Patients, we sort of come from an age, or will tolerate waiting 5 or 10 or 15 or 20 minutes, or sometimes long in the waiting room. Anecdotally, that's not the case. Support people. So nursing staff, PCAs are busy. We know that, and waiting sort of 5 or 10 minutes in front of the screen, people seem to have a lower threshold face-to-face. So that's the before the consult preparation. During the consultation, there are some things that are different to, I suppose, the traditional face-to-face consultations. So you presumably have got consent prior. You need to have confirmed that. And what I tend to do with the patients is immediately start trying to build rapport, and this needs to be a conscious thing. I will actually make a point of acknowledging the telehealth modality, saying, look, I know it's a video consultation. I'm sure it'll make it work, but thank you for being flexible, and making sure that they can hear and see me okay. And some small talk, how are you? A couple of comments about other things. And then I will always make sure I'm talking to the right person. Okay, that's really important. It's very easy to get that wrong. So 3-point patient ID. It's also important to introduce yourself. Don't assume that even if you've seen the patient before, they know who you are. So my name's Sanka Madoru. I am a geriatrician. I'm one of your specialists. This is why we're meeting today. Pay attention to body language, pay attention to speech. I think it's important that the camera is sort of not so close that all you can see is the face. You need to be able to see their arms, arm movements, and so you can pick up on changes in how they're feeling about the consultation. If they're looking defensive, if they're looking agitated, helps for physical examination and your actual clinical appraisal as well. And the other thing I do is I try and have the patient image on my screen just under my camera. And that way, if I'm looking at the patient from their end, it looks like I'm making eye contact with them. Whereas if the patient image is off to the side and I'm looking down here, it looks like I'm looking away from them. And that can actually interfere with rapport again. So just something to think about, and just make sure you're looking into the camera so it's not sort of interfering with things. So that's kind of a crash course of everything I've learned over the last 5 years dealing with telehealth consultations. It's definitely much more acceptable now than it was when we started before the pandemic. I think that's actually accelerated things quite a long way. Probably my 3 takeaways from this. Firstly, the preparation is really important. at your end and engaging the patient and engaging or the resident and engaging the support people, your colleagues in residential care. And vice versa, right? So from the care facility perspective, really important to make sure that the visiting doctors and clinicians are brought on board. Secondly, well, just that engaging with the other parties to make sure everyone's on the same page. And finally, I think the success of telehealth and video telehealth specifically in a broader context and over the long term depends not just on clinical utility. I mean, that clearly is there, but it depends on everyone having a good enough experience or being free of major problems to say, you know what, that was pretty good, I'd like to do it again, rather than that was a waste of time. I only got the video up in the last minute of the consult. You know, that's too much of a pain, I don't want to do it anymore. So adequate preparation leads to a good clinical experience, a good user experience, makes it more likely that everyone wants to do it the next time. So good luck. I think it's a really useful way of seeing patients and adding value, and hopefully this has been helpful. Thanks very much. I think we're taking questions at the end.
Thank you so much, Dr. Sankar. That was an amazing presentation on how to coordinate telehealth in aged care facilities. So thank you so much for that. Now I introduce you to Maura Osman from the Australian Digital Health Agency, who will be presenting today on the My Health Record. Over to you, Maura. Thank you so much for filling in for Vandana, who is unfortunately not well today. So thank you in the last minute for presenting on her behalf.
Thank you so much for having me. It's a pleasure to be here, and thank you to all of the speakers. Certainly insightful to listen to that and to watch the demonstration from Health Direct. So I'm here today to talk a little bit about how My Health Record can support when you're conducting telehealth consultations, as well as generally broadly for patients, but I guess more so in particular in the context of telehealth today. So most of you would be familiar with the My Health Record system and what it is. We're just going to briefly touch on that today, as well as the key information you can obtain from the record. And then we're going to talk about some of the settings within the My Health Record that a person who owns the record can change, so they can adjust the settings to manage who can access their My Health Record. And then we're going to talk about how you can access the My Health Record and familiarise yourself with some of the documents in there. So what is the My Health Record? The My Health Record is essentially an online summary of a person's key health information. It's personally controlled, so a person can choose how often or how little they interact with their My Health Record. They can choose whether they wish to interact with the record themselves or whether they'd like the assistance of perhaps a carer or a family member or friend to assist them in managing their record. They can choose the level of access that this person that they allow to access their record will have, whether they're allowed to view only, so they can share the information with healthcare providers, or they're allowed to make changes in that record. The My Health Record is also a part of a national system, so it's accessible 24 hours a day, 7 days a week, all around Australia by healthcare providers who are authorised to access the system. And finally, it's protected not only by the highest layers of cybersecurity, but also by legislation, so that any intentional misuse of information that's stored in the My Health Record is severely punishable by law, not only for the individual concerned, but also for the organisation they come from. So what are the benefits of using My Health Record? From a health sector perspective, it improves the continuity of care, particularly when we talk about persons who are transitioning from care settings. So if you've got a resident who's recently admitted to the facility, or they've recently been discharged from hospital and returning to the facility, because it allows you to access health information that you may previously not have had direct access to. And this may then result in decreased duplication and wasted resources seeking that information out, or repeating testing unnecessarily. From the healthcare provider organisation's perspective, it reduces the time required to gather information by allowing an opportunity to a new complementary source of information, and this can help improve the efficiency in decision making when you're able to access more detailed information about your patients. And from an individual's perspective, of course, their healthcare providers having more detailed health information about them is ultimately in their best interest to receive tailored healthcare for their individual needs that looks at them holistically. But also it allows them the opportunity to have access and have that control over their health record and to be engaged in their own healthcare if they're able to and cognitively able to do that. And ultimately, these things combined result in improvements in patient outcomes. So as a healthcare provider, when can you use the My Health Record? In the process of providing care to a patient, even if you're not directly in a consultation with them, so even if they're not in your office or you're not having a telehealth consult right now, but you know that you'll be seeing this patient or they're your regular patient, you have authority under the legislation to view their My Health Record without seeking permission beforehand. Now, similarly with uploading information to their My Health Record, again, so long as it's for the purposes of providing healthcare, you do not need to seek their permission, although we do recommend as best practice that you let them know that you'd like to upload something to their My Health Record in the event they may be sensitive about it, in which case you would need to respect their wishes. But the legislation supports you in accessing that My Health Record for the purposes of providing care. Now, I'll note that any other purpose that is not related to healthcare, such as pre-employment checks or providing insurance assessments, they're not authorised uses as they're not defined as providing healthcare, so you would not be able to access the My Health Record for that purpose. You may be wondering how many of your patients have a My Health Record. There's over 23.5 million total My Health Records. So in the context of the Australian population, that means if you've got 10 patients sitting in a waiting room, at least 9 out of those 10 patients will have a My Health Record. And we've got over 23 million of these records now having data in them. So the contents, what's in the My Health Record? There's 3 key sources of information that's contributed to what's in the My Health Record. And you can think of these in 3 broad categories. The first is consumer documents, so documents that the consumer can upload themselves to the My Health Record. So things like personal health summaries that can contain the medicines they're taking, the allergy information. Advanced care planning documents, if they've been completed, can also be uploaded to the My Health Record. Then the next category is the Medicare documents, and this is contributed to the record by Services Australia. So things like items claimed under the MBS, medicines dispensed under the Pharmaceutical Benefits Scheme, Australian Organ Donor Register status, Australian Immunisation Register information. And then the third category is documents that are uploaded by healthcare providers and healthcare provider organisations. So things like a shared health summary from a person's main healthcare provider, most often their GP or a registered nurse. There's discharge summaries from hospitals, pathology and diagnostic imaging reports, prescription records from prescribers, dispense records from pharmacies, and specialist letters from specialists. So these are some of the documents that can be uploaded from healthcare providers. So already you can probably gain a picture of some of the information that may not be available to you directly in your practice, that you'd maybe have to get your administration staff to make some calls and wait for some faxes to receive. So the My Health Record allows you to tap into that directly. Now, the image at the center of the screen shows you the My Health Record system generated overview documents. These are not documents that are uploaded by a specific healthcare provider. They're actually My Health Record system generated dynamic views, which pull information from different documents that have been uploaded to a person's My Health Record and condense it into a single view. So for example, the medicines information view can collate medicines information over a 2-year period that's been uploaded to a person's My Health record and condense it into a single view that's hyperlinked to the source document that that information has come from. So whether that's from a discharge summary from hospital or a prescription record from the GP, that will be condensed into a single view that you can clearly follow to the source document to find out more about the healthcare provider involved in that episode of care, as well as their contact details. There are other overviews. So there's the Medicare overview, the immunisation view, the pathology reports overview, and the diagnostic imaging reports overview. Here's a screenshot of what the medicines overview looks like. You can see the tiles at the top there that take you to quick links within the view. So what I've got it on screen there is the allergies and adverse reactions highlighted, and you've got a summary of them there. You can then click on the hyperlinks in the section below that to view the original document and read about that incident in more detail if you'd like to know more. The medicines preview will allow you access to a summary of the medicines the person is taking according to their My Health record, and then quick links to the most recent shared health summary and discharge summary if the person has been to hospital and discharged. This is an example of a shared health summary uploaded by a person's main healthcare provider. So it's like a snapshot of a person's health at a particular point in time. And you've got 4 key areas reported on here. So allergies and adverse reactions, medicines that the person is taking at the time, their medical history and their immunisations. And then at the bottom, the administrative details section shows you the contact details of the healthcare provider who's uploaded this document and the organisation they come from. The pathology reports overview is another useful overview in the My Health record, and this can be used to group pathology test results. So for example, if you are assessing a patient and you were not the healthcare provider that was involved in requesting this pathology testing, you can actually go to the My Health record, and if those pathology reports have been uploaded, and we are seeing increasing numbers of pathology reports and pathology providers uploading to their results to the My Health record, those results can then be grouped. So if you wanted to group it, for example, by date or by test name. So if I wanted to consider, the management of a person who is has diabetes and have a look at what their blood glucose levels have been over the last 2 years, I can look at their glycosylated hemoglobin results, group those HbA1c test results over the last 2 years together and order them by date. And I would be able to have a good bird's eye view of what their overall management has been, even though I wasn't the healthcare provider that was involved in their care and I wasn't the one who requested that testing. So it gives great insight and may allow you to, support you in those clinical decisions that you make. It's also beneficial to utilise this for viewing discharge summaries, with over 97% of public hospitals connected to the My Health record and the automation of the upload of the discharge summary. So clinicians don't need to actually change their workflow for this discharge summary to be uploaded from a public hospital. They only need to intervene in the process if they want to withhold an upload. So more often than not, when a person has been to a public hospital and discharged, you will see that document uploaded in their My Health record. And this is particularly helpful. So if, a patient of yours at a residential aged care facility, for example, has been admitted to hospital, they've now been discharged, the facility has reached out and they'd like you to see the person. You can't get in, but you're going to organise a telehealth consult just to quickly review and chart some of the changes that have been made to ensure that the person is able to continue receiving their medicines. You can access the My Health record to view that discharge summary and see what changes have been made in that hospital stay. The consolidated immunisation view is just like a summary of immunisations that the person has received, whether that's been reported in a document that's been uploaded to their My Health record or whether that has been uploaded to the Australian Immunisation Register. Now, I'm going to touch briefly on patient control of their record. A person can choose to restrict access to a specific document in their record by placing a limited document access code on it, or they can choose to restrict access to their entire record by placing a record access code on it, in which case they would need to give the healthcare provider or their carer would need to give their healthcare provider the access code to access that record. Once they give that access code, whether it's for a specific document or the entire record, once they give that to a healthcare provider, that healthcare provider will be able to continuously access that record or that document for the next 3 years without having to re-enter the access code. Similarly, any other healthcare provider from the same organisation would be able to as well, unless the person logs onto their My Health record through MyGov and revokes that consent earlier. In an emergency situation, a clinician can bypass any of these access codes to use what we know as the emergency access or break glass functionality that will allow a healthcare provider to view any document in that person's My Health record. However, any instances of use of the emergency access functionality are audited by the system operator, which is the Australian Digital Health Agency, and they would need to explain why that functionality was used. And individuals or their carers can also choose to receive an SMS or email notification whenever their record is accessed by an organisation, and they can log on to their My Health record and view an audit log of who has accessed the record. Now, I'm going to touch briefly on the new My Health app that can be downloaded and used by consumers to access key health information in their My Health record. Now, if a person has nominated a representative to help them manage their My Health record, they can also gain access to that record through the My Health app. And it allows consumers to share their documents that contain their health information with other healthcare providers or organisations in the event that they're not able to access them directly. So if you'd like any further information or support from the Australian Digital Health Agency, our details are on the screen. You do not need to write these down because you will receive a copy of these handouts following the session today. So this is the QR code that we mentioned earlier that will allow you to provide feedback to the session. We welcome all feedback on any of the presentations this evening. If there was something that you would like to know more about or you feel that we could have addressed more, please do let us know so that we can tailor these sessions to meet your learning needs. And with that, I will hand back to Sonia to see if any questions have come through.
Thank you so much, Mara. We do have a couple of questions. These are both for you, it looks like. So the first one is, whose responsibility is it? Whoops, looks like it's just...
Oh, I've stopped the sharing, so I'm not distracting people.
That's okay, because it just sort of moved away from me. Whose responsibility is it to create a My Health record, the patient or the practitioner for the patient?
So the My Health record was rolled out as an opt-out system in Australia, which basically means that unless there was a particular period of time, and I think it was a 3-month window a few years ago now, where people had the opportunity to opt out of having a My Health record created, and if they didn't opt out during that period, they had one automatically created for them, which is why the majority of Australians have a My Health record. Even though some may not realise they have a My Health record, the majority of them do. And when they interact with the health system, so if they go to hospital and they get discharged, for example, and it's a public hospital, they're likely to have a discharge summary uploaded to that record. If you'd like to know whether a patient of yours has a My Health record or not, you can actually, through your software, assuming that it is a conformant software, and we do have a conformance register available on the My Health record website, sorry, not the My Health Record website, the Australian Digital Health Agency website. So if you visit the Australian Digital Health Agency website, you will see the My Health Record Conformance Register there, and it's updated with all the software products that are conformant with the My Health Record. And if your patient is in there and you ensure that you have all of their key demographic information in place, you can actually validate the individual health identifier and be able to see if they have a My Health Record. The system will let you know. If this is something you require support with, you're welcome to reach out to the Australian Digital Health Agency, your local primary health network, or your software provider. We can all help you in utilising your software to determine if a person has a My Health Record or not. Now, if a person has a My Health Record and they have chosen to cancel it at any point in time and they no longer have one, or if they opted out during the opt-out period and so they don't have a My Health Record, they can choose to create one at any time. Once it's created, again, it will be an empty record. So they would need to then fill that as they interact with the health system.
Excellent. And just another question. Thank you for that. What is the best way to utilise My Health Record once telehealth consultation is finished?
So the My Health Record is useful regardless of whether it's telehealth or not. I guess it gives you access to information that you may not previously have had direct access to. So how many times, you know, away from the telehealth context, how many times have you been in your practice with a person who has been discharged from hospital that's here to see you because they've been told upon discharge from hospital that they should present to their GP in the next week, but unfortunately they didn't, you know, wait because the discharge summary wasn't ready, and they told them they would send it to the GP or they would post it, and the patients arrive before that discharge summary has. So then the doctor and the admin staff need to spend time to find that discharge summary before they can even begin to make any clinical decisions about, you know, changes for the patient. So, or if you're seeing a patient that, you know, their GP is away or they're traveling, you know, this will allow you access to information about this patient that you otherwise may not have had access to complete that picture, another piece of the puzzle. And if we think of patients, for example, who may have, you know, cognitive impairments or, you know, maybe suffering from conditions that, you know, affect their ability to be able to retell their medical history, or they're seeing multiple complex, you know, specialists for their complex healthcare needs, it may be difficult to recall all the detail or all the changes, or if, you know, they speak another language as their first language, there's lots of things that can get in the way. And so sometimes even having access to the My Health Record to see which pharmacy is dispensing their medicines, which is something that's automatically uploaded once the pharmacy has configured their system. Again, the pharmacist doesn't need to change their workflow. That would be uploaded to the record. And something as simple as that, knowing, you know, where they have their medicines dispensed, may allow you access to what medicines they may be taking that you may not have previously had access to. So it's, I guess, how the My Health Record can help you is very different depending on the patient that you see. But if we're talking about a patient who is, you know, able to tell you all of their medical history, you know, is on top of everything that's happening, well, maybe for that patient, you don't need to check their My Health Record. So it really is on a case-by-case basis.
Excellent. Thank you, Marwa. There is another question. Do you receive pushback from clinicians as My Health Record has been perceived as doubled up with tending medical centres' clinical records? If so, how do you combat this, encourage uptake?
So look, it's very mixed, but certainly what we're finding is as more and more information has become available in the My Health Record, people have and clinicians have started to see its worth. So for example, the need for people to have quick access to their immunisation information, and with immunisation information being uploaded to the Australian Immunisation Register reflected in the My Health Record, we saw an exponential rise in the access of that. people wanting to access their, pathology and COVID test results. And we're certainly now seeing a lot of consumers utilising the My Health Record to access their pathology information. And for the majority of the pathology testing, they will need to wait for 7 days before they can gain access to that, so that it allows their healthcare provider to initiate any recalls if need be to discuss the results. There are some exclusions to that, like COVID tests and some other respiratory testing, but certainly we're seeing now that as more and more pathology providers are becoming involved, more uploads with 99% of GPs and pharmacies connected, there is more of a value case, and we're slowly gaining traction with, specialists, allied health, and these are the areas that the agency is working now, as well as with residential aged care and pathology and diagnostic imaging providers. So we expect that, with more and more healthcare providers coming on board, that value proposition is certainly increasing.
Thank you. And Dr. Sankar has also replied saying, I tend to review a patient's My Health record to see if tests have already been done, so I don't duplicate requests. I also review hospital discharge summaries that are not sent to me. Our practice is also linked with My Health Record uploads. So after the consult, our specialist reports can be accessed by the patient, their other clinicians in future as well. So thank you, Dr. Sankar, for that reply as well. I think we'll need to close our session today. Just before we do go though, we have added the link in the chat for the survey as well. If you are not familiar with using the actual QR code, you can click on the link. So please provide your feedback. Really important for us to receive your feedback. Again, I'd like to thank our beautiful presenters today. Thank you so much, everyone who has presented, and thank you for everyone who has attended today. Thank you, and see you later. Bye.
Thank you.
Thanks, everyone.
Thank you.